If you struggle with having a chronic sensation of stiffness in your hip flexors, I'm going to tell you in this video why you should fight the urge to not go straight to stretching for this. It's really common for people who have persistent issues with back and hip pain to have muscle imbalances that exist around the pelvis. When this happens, this can throw off healthy mechanics at the hip. For anyone that has persistent issues with stiffness and pain on the front of their hip, it can be really helpful to remember that it's important to have balance around the entire hip. So there is a ring of muscles, not just individual muscle groups, but think of it as a ring of muscles that sit around the hip that help maintain normal mechanics and movement at the hip. A really common imbalance is when there's excessive tightness and gripping in the muscles on the back side of the hip and weakness and underactivity in the deep muscles that sit on the front side of the hip.
When this happens, the femur will have a tendency to glide forward towards the path of least resistance in the front of the hip when the hip extends backwards or flexes forward. This movement pattern, when done over and over again during exercise and daily activities, can lead to pain and stiffness in a number of structures located near the front of the hip. The problem this can create is a feeling of chronic stiffness that can be felt on the front of the hip and around the upper thigh muscles. Many people will turn to aggressive stretching to help with these symptoms. The problem with aggressive stretching is that this will feed into the muscle imbalance that's causing the problem in the first place.
Are there ever circumstances where hip flexor stretching or soft tissue work in that area are needed? That depends on whether you're truly short and stiff in those muscles or if you're overly lengthened and weak. The Thomas test can be an extremely helpful test that you can do to yourself to see if you really need to be doing stretching to this area.
To do this test, lay on a table and pull your opposite leg back until your pelvis and back first become flush with the table. If you still have space between your lower back and the table, keep pulling that leg back until this space is gone. It's from this point that you'll be able to tell if your opposite leg needs stretched because the hip flexors are tight. If this leg falls easily below the table, then your hip flexor length is normal and you don't need to be doing any stretching. If, however, your leg rests above the table, then you know that your hip flexors are likely short.
If you do test tight on the front of your hips with this test, then the following exercises and stretches are things that might be helpful for you.
A common mistake made with hip flexor stretching is to drive the leg too far back and not lock the pelvis in from the top. This makes you lose the stretch at the upper insertion point where the hip flexors attach at the top of the pelvis. When this happens, all you're doing is driving the ball of your hip joint forward in socket, which is the movement that actually triggers most people to have chronic hip flexor tightness in the first place. To perform a true hip flexor stretch, you'll want to make sure that you lock in the stretch from above by rolling the pelvis backwards or keeping your back flush with a wall and holding. You should feel a light squeeze in your glutes from this movement. Make sure to hold this light glute contraction for at least 30 seconds. Relax and repeat 3 to 4 times. You should feel a pull in the upper thigh in front of the hip as you do this. If you don't feel this, make sure that you don't have any type of a gap between your leg at the wall. Doing a soft tissue release while you perform this stretch can also be helpful to try for improving pelvis positioning and hip flexor length. The most effective way to do this is to push just to the inside of the most bony part of the front of your pelvis. This can be done with your hands or with the tip of a massage stick. Push with a moderate amount of pressure and hold as you do your 30-second bouts of stretching. Oftentimes, a little soft tissue work is all that's needed for those with tight hip flexors. Once you do this, look to see if you've made improvements by redoing your Thomas test. If you have a normal Thomas test but still feel stiff on the front of your hip, try working on some exercises such as these to help open up the muscles in the back of your hip, which will help promote a more centered position of the femur in socket. After doing this, then turn your attention to strengthening the deepest part of the hip flexors using exercises such as these. If you found this video helpful, please make sure to subscribe to my channel so that you can see more videos like it.